So of course you have to explain what you're going to do to your patient, and that's what Courtney said, make sure you have everything with you so you don't keep running out of the room, and clean up the bedside, and of course position your patient. Most of the time when we have bariatric patients on our floor, putting their head down and clearing out the abdomen, usually you get a better insertion.
And level of the bed, sometimes with like females, if you put them in a Trendelenburg, it makes it a little more visibility to see things depending on who the patient is. The position of the legs with the female. And then I always like to make sure especially with a female, look first before you start doing everything sterilely, so then you know where you're going, and yeah. So at least you have an idea. So the things that we want you to take into the room with you is we have our new Foley kits. So most of you have used these already. It's numbered, so it's really easy to know which step to do once you open the kit. And then the sterile drape. So which this might change if we can get the sterile cloths, but this is a large drape, so if you use this to lay over the bottom portion of your patient, that's going to give you a nice big sterile field, so then you're able to put your sterile kit there to insert the catheter, everything will stay clean. You're not having to use your table and bringing things over, it will all be right there, right in front of the patient. Your lidocaine, the Eurojet, so like I said on 6 North, these are stocked in our mid-Pixis, but I'm not sure about the other floors, but it's something we can talk to pharmacy about. Dr. Darling will be speaking to the physician group, so they're aware that this is the path that we're going to be taking. And then catheter size, so knowing, so especially with a urology patient, if a physician tells you to put a specific size catheter in, making sure you bring that with you because the kits are just 16s. So making sure you go to where you get your catheters and bring the right size. With these mannequins, we have to use a special catheter, so we'll actually be able to show you how to insert and manipulate the catheter for easy insert where it's not attached to the whole kit. And then obviously you're going to have to break the red seal to attach it to the back. And then the lubrication is part of this kit, but for this insert we have to use like special lubricant for these mannequins. So you'll see me pouring lubricant into the tray for Rhea. That's not a step you have to do, it's just specific for these mannequins. And then TheraWorks, do you want to go over to TheraWorks?
So TheraWorks has been trialed in ICU and ER for a couple of months. So they've started using this just to see if there's a CAUTI decrease. And how many months? 3 months, 4 months that they've trialed it. So it worked. I mean, there's a decrease in CAUTI, so we're going to start stocking them in our fixes.
So what are we cleaning off of that towel?
So there's 2 wipes in the package. You're going to use the first wipe at the beginning before you do your insert to prep the patient. It's just essentially a clean peri-care. And then the second wipe you're going to use after the catheter has been inserted to clean the tubing. So before you're inserting a catheter, you're obviously going to clean the patient first, whether they've been soiled or not. So you can use the soap and water, or you can use the cloth with the TheraWorks. So you're just going to, that will be the first step that Rhea will do.
And then Courtney she's not just handing things, she's kind of the safe, exactly. Yeah, she's watching. And if she sees anything that's contaminated, then she has to call it.
And don't hesitate to say things. We shouldn't get upset at people who are trying to protect the patient. So, if you are doing an insert with a patient, just find a way without saying it to upset the patient, but to change their gloves. We have hundreds on the floor, so it's not a big issue just to change the gloves and to save the patient from getting an infection.
You know, the other thing I sometimes observe is that if the gloves don't fit, you actually end up contaminating. And that's something to see.
And with that being said, especially for the males, if you know that the gloves inside the sterile kit don't fit you, bring extra gloves for the size that fits you. It's okay not to use what's provided in the kit for the gloves.
Really, yeah, that's why I was asking you guys, you really want to know your surgical glove size and make sure I don't know about the stocking and inventory. You may want to have a stash of those gloves somewhere when you come onto the floor, so you just know where your gloves are. You put them back. I don't know how that works, but it would be nice.
So Ray's just going to start by doing the pericare. So we start with that.
So you may need,
So we're doing soap and water and the light?
yes. So I use at least 3 or 4 if your patient is, of course, if they're soiled, then you may need some more. And they want you to do the whole area, clean the inner thighs.
Can somebody tell us what is a very likely organism to get into the bladder? And why is that? Why is it E. coli? It's where? Right, and why is it on the perineum? Right. Exactly.
So
E.
change
coli.
your
Coli.
gloves.
E. coli as in coliform as in colon.
So then she washed her hands again in between, she just prepped, even though she had gloves on. So wash your hands before moving on to the next step.
Can I talk about about the ingredients?
Ray, you want to just take
Rhea has gloves on.
So there are
Fit beautiful.
two wipes in here.
The other pages are already.
You're gonna save the
Second one.
the second one for the last step. So you just clean this, throw it away.
So one of the things that Dr. Darling pointed out, and it's important for everybody to keep in mind, is once this kit opens, it's sterile inside. So you're going to notice that Ray's going to put a pair of gloves on. I'm going to open it and hand it to her to keep the kit sterile. So what we're going to do first is she's going to put the gloves on and we're going to lay that drape over the patient's lower portion of the body. So then when she takes her kit, she's going to have a sterile field to lay her kit on. And then everything is right there for you.
And do you guys want us to hand sanitize after every glove change?
Yeah. That's twice.
One thing to add is on the Theraworks wipes, they're silver impregnated. What does that do, Dr. Chen?
It's an antiseptic.
So you're doing something additional, so you've done soap and water, and then this is another layer of different.
And I believe you can leave, is it up to 3 minutes that you, how long is it? I think there's
At
a,
least you're waiting until it's dry, that's for sure.
yeah, so
You know.
I think it can dry and then I believe it's like a few minutes that you have and it's still, everything is
You know,
antiseptic.
the washing before an application of this antiseptic cloth is critical, because you want to get rid of all that organic matter. And I think sometimes people, when they do the fluorescent bathing, you really have to remove the organic matter before you do the fluorescent bathing cloth. So I think that's a critical point. The other thing I want to highlight is the fact that you clean your
Table.
stand, because there's a lot of different bacteria on there, and it's very easy to transfer that bacteria. And once in a while you'll get this environmental bacteria in the urine, you wonder why. This is why.
Yeah.
So then I'm gonna open the drapes for Rhea.
How many nurses in here are ICU nurses? So this is,
It hasn't been.
central lines, yeah, I
That's
mean,
great.
yeah. I mean, you didn't wear gowns when you put in central lines, right?
I think physician bodies are well.
Yeah, well, we don't want this to be, you guys have actually been doing a great job, it's the numbers that we're trying to work on. this
Clean
person,
glove.
just
Yeah.
clean gloves. She's in the this is the non-sterile world, right? She's in the clean world, Rhea's in the sterile world, and all this stuff,
Pulls apart.
right.
But with that being said, I have to keep Rhea's world sterile, so I need to be mindful that I'm not touching things with my clean gloves.
So your kit also comes with your Castile wipes that you can use to clean the patient, but since we've already done that, you can skip that part. But if you don't have the TheraWorks, you can use the Castile wipes that is included in here.
You're not gonna use this, right?
Yeah.
Okay, so I wanna make sure everybody's clear on this. You have any kind of cap?
No, that's for the mannequin.
Oh, it is? Oh.
Yeah.
Can I open it?
Sure.
All right, so this is, right, who cares? Right? So then when you get to this point, open this thing. Allows you package opener. When you get to that point, is it okay to do that?
No.
That's already sterile.
Even if you did that, you still haven't technically, scientifically, you haven't touched the catheter, but you have slippery gloves on. It's almost impossible to open this thing and not contaminate it to get this out. So I just want to make sure you're clear on that.
So there's an arrow. It says right-handed pointing towards the insertion site. So left-handed will be
Flip.
you flip it.
If you're right-handed, you stand on the right. If you're left-handed, you stand on the left. And just flip the box around.
But can you guys see how we've expanded, rather than her sterile field just being this square, now you have this huge rectangular area where you can work with.
There's another pair of sterile gloves that you can use maybe. You have your another set of drapes that you can use. I like to put it on top.
And then I'll finish getting her ready. So this is a package too, so everything that's inside of this is sterile as well. So the patient, the nurse who's helping can just open and drop it. And same thing with the catheter. So pretend this wasn't just open, but and then you can either drop it or you can grab it. And then you
So
can-
now, your kit, if you haven't seen it, there's one, it's numbered, how you're gonna, the steps. But there's one step that we're gonna skip because urology, they're not recommending it. It's attaching the syringe to your catheter.
So when you're inserting the catheter, you don't want to already have your saline connected. You want everything to be separate. So you're not going to insert that saline, attach it until the catheter is in, you see urine, you have the patency of the catheter.
Why is that?
I just was thinking, I'll use this as a little prop. So let's pretend this is the catheter here. And this is all the junk hanging off, the tubing and the syringe and everything. You're trying to insert this with fine fingertip control, which is not that easy to do, and you're trying to
Saline is heavy.
you're trying to feel the catheter go through, and you've got this going on.
It's dragging it.
So that's why you'll see all the urologists will pop the catheter off the end of that tubing, because we can't, and that's why I want you guys to wear surgical gloves, so you can use your your tactile skills to be able to really feel the catheter go through. And look at the patient's eyes while you're doing it and get a feeling for where it's at. You can only do that by practicing, but this is just a bunch of burdensome junk. And it kind of really gets awkward, and it creates some kind of thrusting movements to kind of overcome the weight of the tubing and the syringe. That's a whole other issue.
And you're also saying we don't have to test the balloon. It's,
No, there's no
Dr.
reason to.
Roberts told us the same thing. It's
Yeah.
they're not gonna
No.
be
These
effective.
balloons will take, these 5cc balloons will take 50 cc's of water for the person.
If you look at the catheter, it's smooth, and once you test the balloon, then you
Yeah.
It's got the bump in it after.
Yeah, then it creates, that's what he's getting at. then it creates
You
trauma.
know, I wanted to say one thing, that if everybody wasn't here when Dr. Roberts was here, for years, I have taken the penis and held it up and tried to put
We're
it
gonna
in.
talk about that.
Oh,
yeah.
good. Because that was, I couldn't even
So,
believe how hard
That's the
I was
first
making it.
step of it. It starts here and goes here, yeah.
yeah, as
Yeah.
much as
I know they say that in the books, I've seen 60 degrees or something, but they don't talk about going down.
as much as it's important for how you're positioning your female with the legs, it's just as important with the male with how you're positioning the penis as you're inserting the catheter. So we'll kind of show you the different steps as you're inserting it and where you should have like the level of.
Do you guys still use like an emesis patient on the sacrum sometimes in the female patients to raise them up so they can get better access? You do that.
Bedpan, upside down bedpan.
Yeah, upside down bedpan. Yeah, that's a good trick. But you have to do, obviously, at the very beginning, you gotta do it. And make sure, you know, that if that also speaks to the position of the bed, not only the height of the bed, but if you can do it with a particular patient, a lot of them can't go flat because of their pulmonary dysfunction, but if they're in a hole, it's really tough to do any of this stuff. When you're reaching down into it, and perineum pointing into the ground, it's just no good. You're more likely to contaminate them.
Since we can't use betadine on this mannequin, so we'll pretend that I poured the betadine on the swab. You want to put the
We're still gonna use the betadine, right?
Yes, we just can't put it. So with these kits, you just pour the betadine in. There's 3 swabs that are lined up next to each other, then they just snap out. You use each one.
And you start from the urethra?
So first one says start from the meatus, go circle, 1 circle for 1 swab. Second. Again, like that.
So who's thinking about the uncircumcised patient right now?
So yeah, with uncircumcised patient, you have to retract the cervix. and then
If you can. If not, do your best, and don't be shy about getting that swab. If you can get it under the foreskin, and get it around the glands. Snegma and all the nasty stuff is in there. We may not, like Dr. Chin said, get it organically out mechanically, but you may get some betadine coverage just so that once we get the catheter in, we're away from that.
See that I drape on top of the penis, so I still maintain my sterility. So you could still use this in case you need to use 2 hands.
Once you've used the Eurojet, do you still need to use that other lubricant?
Usually, because the catheter absorbs a lot of fluid. Yeah, well, you don't have to, but you usually, or use a little
We'll show
extra.
them how to do it.
Yeah, that's a good question, because that's where they feel it right on
No.
the edge, you see their glands
The Euro-
innervating.
So for the Eurojet, you're just gonna snap this top off, pops off, and then again on the smaller tube. And then it's just gonna screw in. And then when you're administering it, you're just gonna push. And like Dr. Darling said earlier, you're gonna push with force. And especially, it's nice for the males because it's just a nice tip that will fit.
And you're not gonna, you know, they are gonna bleed a little bit, because you're gonna hydraulically, especially in the males, you're gonna hydraulically dilate the urethra, and their sphincter is gonna, it's like poking somebody in the eye, they're not gonna let you do it, right? So there is gonna be some blood. That's just part of doing it. You haven't hurt them, you haven't done anything bad to them.
So either you hold it in like this, or pinch.
For the male patient, you can hold inside your thumb.
Only for a minute.
For a minute. So let's pretend it's in a minute. So once you're in the junction,
Tell them what you're feeling, what you're, on the male patient.
so there's resistance. Pull it down towards the patient's knee and go in.
This is the guy with the straight. Well, that's like, what if there's no resistance? Yeah. You probably are all just, yeah.
We should talk about when we call you.
Yeah.
So a lot of times, like when Ray and I will go to other floors and insert, or if we're on the floor, I'll usually bring a pair of sterile gloves in, so then at this point I can kind of help her to kind of speed up the process. So as she's inserting the catheter, I'll usually with my sterile gloves, I'll break the seal and help her connect, and then so we can inflate the balloon right away.
The seal's a good idea, you know, it's theoretically, right, it's it keeps the system closed. But it's only for the chip shot, the really easy female one, where you know, the catheter goes in, there's no doubt, 500 cc's of urine comes back, you don't have to irrigate, you know you're there. But more difficult ones, it's not perfect.
I found it pretty difficult to use a securing device with that catheter inserted almost all the way to the Y. I mean, it's like right here. But
Oh, well, it,
Pull back. Yeah.
all the way, you pull back until you got, that should be your good feeling. And you'll see us will go, oh, okay. Because we're feeling the balloon come back. We know we're in the bladder. If you don't feel that like stop, then you're stuck in the urethra.
So what Dr. Dunn
Good
said,
question, though.
insert it all the way to the Y. Make sure you have urine before inflating the balloon.
How many bladders do you think the urologists in this hospital have seen perforated from inserting catheters all the way to the Y? None. None. You will never harm somebody by doing that. If you have a patient who's had direct bladder surgery, and we don't do a whole lot of it anymore, but we do it, that's a different animal. That's a call to the urologist. And you look, so are you operating directly on, did they open this patient's bladder? Are there sutures in the bladder? Then that's a different deal. Then you want the urologist to take responsibility for that. But that's almost never the case.
Now, as far as patency, when you use the lidocaine, sometimes it will clog the end of the catheter a little bit. So you usually need to wait like about 30 seconds. At this time, if you raise the head of the bed of the patient, that sometimes will help allow the urine to flow. If you push on the bladder, but patency is the most important thing.